The mission of a local nonprofit is to provide leadership, direction, and integrated resource management for quality services that support their vision of success for children. Coming up on Polk Place, we'll talk about the state of county child care centers during this COVID-19 pandemic. Make sure you stick around. Welcome to Polk Place. I'm your host, Brian Lacey. Joining me in studio is the executive director, let's call him the chief executive officer. There you go, Dr. Mark Hutek. Normally I don't get to do these interviews.
I know, it's a treat. Thank you for being here. Thank you for allowing me.
Given our current working situation, we don't have a full crew, so I think in the history of my 19 years being here, this is the first time I've hosted every single one of them.
Okay, so is this a good thing?
Oh, I don't know. I'll let you know after I put them together.
That's awesome.
Yeah.
Well, we certainly appreciate you allowing us to come on today.
Well, let's talk a little bit about what the Early Learning Coalition is doing during the pandemic. How has it changed how the child care business is run?
Well, you know, across the state, obviously, the way that child care centers are funded through the Early Learning Coalitions, you know, in general, their purpose is to help subsidize child care services and to provide those VPK programs. So on one hand, you're looking like the school district programs in VPK, and on the other hand, you're looking like you're just supporting those mom and pop neighborhood child care centers. Well, in Polk County, we deal with well over 300 of those child care centers that operate within those two programs, between our school readiness and VPK programs. And so for many of those, right, you're dealing with organizations that might be like school district related, where we've got programs in schools, and of course they shut down and all of that happens, and they've got to follow the guidelines and the policies of the public schools. And then you've got programs like Jimmy's Daycare out on the corner somewhere, where in those cases, you know, they're dealing with a small business. And when you take like any small business in this pandemic, you're dealing with workloads, right? So all of a sudden you get the President of the United States, the Governor of Florida, the local municipalities coming in and saying, hey, people need to stay at home. Well, people will keep their children at home. Yeah. Well, when children stay at home, then what happens, right? So just like any other business, many of our child care businesses are facing the same crises. Now they may have a school or a building that normally houses 100 children. You know, tomorrow with a lockdown, they're down to 10, right? 10 essential, you know, families that they need to work with. And that's devastating from a business perspective. So that's kind of where we're at. We had major close downs, and it's just kind of like a recovery process at this point, like all small businesses.
One of the things that is coming out is the social distancing, and how do you social distance with small children, and also what other changes are occurring within childcare?
Well, I think the state of Florida in general has done a very good job working with, at least from our organizational perspective, in working with our local health departments to really provide the guidance for those kinds of situations. We have received consistent emails and documents from the Polk County Health Department. Dr. Joy Jackson is an amazing leader there. From the Department of Children and Families, who work with the state levels, and from the Florida Department of Health in general. So we're constantly getting these guidelines that our child care facilities are constantly receiving that will tell them, hey, business as usual no longer exists, right? You need to stagger your parents on when they're dropping off children so we're not exposing children to unnecessarily other parents. You need to make sure that your waiting areas are no longer confined. Maybe you don't let your parents in the building. You need to make sure that you take the temperature of every single child before they come through the door and even lay a hand on any of the toys or any of the desks or seats or blankets or mats or anything that may be in there. You know, you need to take the temperature of the child. You need to follow up with the parents any chance that the kid may get a runny nose or that the child may be experiencing anything out of the norm. So there's so many things going on. And then of course the social distancing piece, right? Children are highly interactive. I mean, the good news to this whole piece is that at least we have found that children appear to be somewhat less susceptible than other populations, but it doesn't mean that you don't necessarily pay attention to the guidelines. So, you know, the state has come in when we limited to, you know, sizes smaller than 10 or larger than 10, you know, those kinds of things. We've done that in our classrooms. So a normal child care classroom maybe that has capped at 15 or 20 children, it's been reduced down to 10, you know, and that's with the teacher. So we're really, most of the child care agencies are just getting to that point where they're learning to work with twice as many staff or half the number of kids or those kinds of things, because the classroom sizes have gotten much smaller as well.
You're offering a valuable child care subsidy to healthcare workers, first responders. Let's talk a little bit about that, if you would, please.
Well, it's an amazing program, and I'm not exactly sure from our perspective whether it's funded out of federal CARES dollars or whether it's funded with some child care development funds that the state uses. But basically, one of the services that I started by saying is that in our community, we traditionally subsidize child care for those folks that are, you know, financially dependent in ways. Well, what the state has done now is they've come back in and they've gone off of the essential personnel list for the state of Florida, and they have said that anyone that qualifies on the essential list by the governor that falls into the categories of healthcare professionals and or first responders, that we will subsidize their child care just as we would subsidize anyone's child care for low-income families. So in many cases, basically what we've done is we've reached out to all of our first responding agencies in Polk County, and we've reached out to all of our healthcare agencies in Polk County, and we've said, hey, look, if you've got employees that have children that are still needing to go to daycare or childcare while you come to work and perform your essential service, we can help cover their costs. And we've got a flat rate that we use based on the age of the child that we pay normally throughout the course of the year. And they get an application from their Human Resources Department, because that's where we've sent those applications to. They fill out the applications, and once they qualify as being in one of those essential jobs, then at the end of the month, instead of them paying their child care agency, we'll pay the child care agency for them. So right now we're up into the, I think we're serving about 400 right now in Polk County alone. The state is serving well over 7,000 first responders by paying for them.
Now, for those that aren't first responders or healthcare workers, what's the process of obtaining child care benefits?
Well, right now we've gone to a virtual platform for everything, like everybody has, kind of a hands-free. So the place to go is at elcpolk.org. If you go to our website, right there on the front homepage, there is everything from COVID-19 resources, you know, for the small business grants for our providers, all the way down to applying for benefits for child care in the community as well. So there's a lot of information at our website. Everything is there. We're fortunate enough to have those IP phones in our offices, so we can unplug the IP phones, take them home, plug them into the modems, and our secretaries and our staff and our receptionists, they work from their homes with the telephones ringing just as they normally would.
We got about 30 seconds left. So how can communities in Polk help and support child care centers and in their need of essential supplies?
Well, you know, the toilet papers and the diapers are becoming a little more easy to find than they were a month or two ago. So that's gotten better. But I tell you, where we're struggling right now is child care providers cannot find sanitation wipes. They cannot find sanitizing wipes for hands, for diaper rash, for anything. They can't find those things. So if anybody has those, find your local neighborhood child care center, make a donation, anything, any paper products, any sanitizing supplies, bleach, anything. Knock on the door, say, hey, I'm here to support you on behalf of the community, and they would greatly appreciate that.
Well, as producer of this show, I just made a command decision. When I see you on the guest list, I'm going to host.
You're going to host?
Yeah.
All right, that's great. Well, we love talking kids. And you know, I'm going to put one more quick plug in.
All right.
You know, we always talk about brain development happens, right, 40% by the age of 4, or 80% by the age of 4, and 90% of your brain develops by the age of 5. This is huge right now with what's happening to children with the social distancing and social isolation. Children really have to be around good quality early child care education. And it's important. And I think that, you know, the social distancing that's occurring and the child care preventative measures that they're doing, it really is important. And every day that a child misses from those kinds of things is a day that they can't get back. So, but thanks. I'm glad.
Well, Mark, thanks for coming in with us. Thanks for joining us.
You,
Come
Brian.
back and again see us real soon. All right.
Awesome. Thank you very much.
Early Learning Coalition of Polk County wants you to know that the quality of early education and care significantly influences academic and social development. Their vision is that all children enter school healthy, ready, and eager for lifelong learning with the collaborative support of parents, families, educators, and the community. As the coalition continues to serve the children and families of Polk County, the next generation is given the opportunity to develop the skills they will need to be successful in the future. Now, if you need more information, you can give them a call at 863-733-9064 or look them up on the web at www.elcpolk.org.
To the child care workers in Polk County, in Florida, and our entire country, we thank you for your commitment to our children during these very difficult times. Without you, many of our community heroes would not be able to go to work. You are our heroes, and the security that you provide to our children during these very scary days is comforting. For provider appreciation, we thank you more than ever. On behalf of the Early Learning Coalition, you truly are our sunshine.